Hello students, welcome to this lecture. Eligibility criteria for screening, right? So this means the set of characteristics that the patients have to have, those are the inclusion criteria, and are precluded from having, those are the exclusion criteria in order to be part of this clinical trial. Okay, so first we look at this Venn diagram, right? So let's say you have two inclusion criteria, right? Circle A and circle B, and they intersect, right? So the patients in the intersecting area are eligible in terms of inclusion criteria. But that's not enough, because there are exclusion criteria, right? So for demonstration purposes, let's imagine the exclusion criteria is just one. Then circle C. So we have circle C. So the circle C is intersecting with that common region, right? So the patients who are eligible are only the patients in the area colored by green. That means that belong to the circle A and B, but do not belong to circle C. So that really highlights what eligibility criteria is. So let's first look at the inclusion criteria for this protocol. So we look at the inclusion criteria. So inclusion criteria number one is advanced or metastatic non-small cell lung cancer, right? That's number one. So remember that circle number one had progressive disease while on prior anti-cancer medication as ascertained by the doctor. So that's two. The triangle number two, remember these symbols, right? Because they are important. Have at least one measurable lesion per RECIST. That's the response evaluation for solid tumors. So have at least one tumor which is measurable, right? Because we need to measure, right? Give the drug and measure. So that's 33. So 4 is recovered from toxicities from prior anti-cancer medication, because we don't want to overshadow our drug with toxicities from the previous drugs, right? So are male or female who are older than 18 years old. So it's for adults. This is very important. And have a life expectancy more than 5 months, because the trial lasts for a longer time. So we need to know that the patient is actually will be alive at the end of the 5 months. Is very sad. And then have adequate organ and hematologic function. That means if all the organs are failing, it's very difficult to get any data for the trial, right? Or the blood, of the blood is failing. That means hematologically failing. They are very difficult. So for this we use blood chemistry, serum lipase, absolute neutrophil count, and platelets, and hemoglobin, alanine, ALT, AST, alanine transferase, that's a liver enzyme. When the liver is damaged, it's released to the blood, right? So you use that. And so serum bilirubin, serum creatinine, that's a marker of kidney damage, and so on. So all those things belong to inclusion criteria 7, have adequate organ and hematologic function. Then we go to inclusion criteria 8, have Eastern Cooperative Oncology Group performance status less than 2, right? So that's like a marker to see the well-being of the cancer patients. You can look this up, ECOG. I have given it in the supplement section. And then 9 is have a normal QT interval in the ECG. So the ECG is like this, and then QT interval is there. So that should be normal. If it is abnormal, that means the heart is beating arrhythmically. If it's beating arrhythmically, that means it's not good, because the patient may get a heart attack or sudden cardiac death, which should cloud data for our trial, right? Then for females of childbearing potential, negative pregnancy test. Obviously we don't want any patients to be pregnant during this period, because we don't know what effects the drug might have on the fetus, right? That's very dangerous. And female and male patients who are fertile use methods of contraception, and even their sexual partners have to use methods of contraception, must provide a signed and dated consent form. So we have done informed consent before, so they must have signed it. Have willingness to comply with the schedule, visits, and procedures. That's very important, because this is a clinical trial, right? So if they don't follow the procedures, how are we going to get any data for our trial? So we have to, that's an inclusion criteria. So let's look at this example. We got 4 subjects. Subject 1, so you see with the inclusion criteria, right? Circle number 1, triangle number 2 is there, 3, 4, 5, 6, 7, 8, 9. So 10 is there, 11, 12 and 13. So the patient has all the inclusion criteria. And then let's look at subject number 2. Subject number 2 has circle 1, triangle 2, 3, then 4, 5, 6, 7, 8, 9, 10, 11, 12. So the lucky number 13 is missing for subject 2. That's inclusion criteria number 13. So we note that down. He's not eligible. Then subject number 3, we have 1, 2, 3, 4 is missing, 5, 6 is missing, 7, 8, 9, 10, 11, 12, 13. So 4 and 6 inclusion criteria is missing for subject number 3. Then we look at subject number 4. Circle number 1, triangle 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 and 13. All the criteria are there. So in terms of inclusion criteria, we say that subject number 1 and 4 are eligible. But we just one part of the game, right? Ball game. Because we got exclusion criteria as well. Those are the criteria which the patient should not have to be part of the study, right? Received anti-cancer medication within 3 days of the first dose of Imagine. That's exclusion 1. Then received monoclonal antibodies or had major surgery within 30 days of the first dose of Imagine. It's exclusion 2. Then 3, having been diagnosed with other primary malignancies. That means cancers at the other places, right? Not the one that spread from the lung, but original cancers at other places, because that will cloud the data, right? Then subject 4, have symptomatic, exclusion criteria 4, symptomatic CNS metastatic, that means central nervous system metastasis that are neurologically unstable. That means the patient might be getting seizures or faint, because the brain and the nervous system is affected. That's a no-no. Have a current spinal cord compression. The spinal cord is compressed, then your organs will fail, right? Then have history of drug-related pneumonia. That means pneumonia of the lung. Have an ongoing active infection, because that will affect the blood markers and so on, right? So that's a no-no for that. Have a history of HIV, because HIV compromises the immune system, and that will put another layer of complexity. So we don't want that. Have a history of active significant gastrointestinal bleeding within 6 months of the first dose of Imagine. Before 6 months of Imagine. Because if they have gastrointestinal bleeding, absorption of the drug will be affected, and the drug might have effect on the damaged gastrointestinal system. So that's a no-no. 2, have a suspect as hypersensitivity to Imagine or its excipients. So if the patient reacts to the drug, like let's say a severe allergic reaction, the patient cannot take the drug, right? So that's a no-no. That's the exclusion criteria. Have a malabsorption treatments that will limit the oral absorption of Imagine, because this is taken orally, right? And if it is not absorbed, we won't get the effect of the drug on the lung cancer, and then the data will be affected. So those are the exclusion criteria. So let's look at the two patients who we thought were eligible in terms of inclusion criteria. So they have all the inclusion criteria, but if you look underneath, there are red markers. Those are the exclusion criteria. So this patient has exclusion criteria 1 and 9, right? The known hypersensitivity. Patient has an exclusion criteria. So that means the patient is ineligible. So the subject 4 seems eligible. They have all inclusion criteria 1 to 13, and it looks eligible, right? But just see number 13. There's something fishy out there, right? There's something behind number 13. So that's a red marker. That means the patient has exclusion criteria too. So like I said, exclusion criteria are maybe not too obvious, right? You have to look under the rocks, right? Be very careful and see whether you investigate it. Like in this case, right? We thought it was lucky number 13, but it wasn't, right? There was an exclusion criteria right behind it, right? So you have to look through all the source, right? So the exclusion criteria 2 is received monoclonal antibodies, right? So that's a no-no. So that means all the patients are ineligible. So we record this. So what is the Dr. PEI Magnum site going to do? They're going to screen more patients. So let's look at subject number 5. Subject number 5 has inclusion criteria 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and 13. All inclusion criteria. That's really good, right? But remember our lesson, we need to look under the rock. So let's see whether there are any other exclusion criteria. So we looked at 1, 2, 3, and well, it's so far so good. There's no exclusion criteria at all. So that means subject number 5 is eligible. So the patients who are not eligible, they would have signed the informed consent form, but they are called as screen failures, right? Screen failure means they signed the informed consent form, they were screened in terms of eligibility, but they were deemed as ineligible, so they are screen failures. So there's a part in the protocol explaining about screen failures in the protocol as well. But some criteria, you can screen them later, right? Because it says 3 months before the drug is given, right? So you can wait for another 3 months and screen them again, right? Or 6 months and so on. But some criteria you cannot change like that. If the patient is HIV positive, it won't change, right, after 6 months. So you have to be very careful, and also the trial might be closed for screening by the time when the patient gets eligible. So that's the learning. So eligibility, inclusion criteria, the criteria you need to have to be part of the clinical trial, and the exclusion criteria, the criteria which you shouldn't have to be part of the clinical trial. And then we sign them as eligible or as screen failures. So that means that's good to go. And in the next lecture, we look at the schedule of assessment for clinical trial protocol. That's very important. Look forward to seeing you then. Bye-bye.